accessibility during the COVID-19 emergency. And although the title slide was not changed to adjust this, we're also going to be discussing economic impact payments, also known as stimulus payments that people may receive during the crisis. During the webinar, all lines will be muted except Dallas's and mine. Please type any questions you may have into the chat. I will break periodically for questions. If I'm not able to answer all questions in the chat by the 2-hour mark, I will go ahead and provide you with a document, email a document after the fact with questions and answers for all questions that I was unable to get to during the webinar. So please go ahead and type any question you may have into the chat, knowing that if it's not answered during the webinar, you'll get a written answer by email afterwards. So I have a 30-year-old son, and when he was quite young, I came home from work one evening and I asked him how his day was. He said, well, I have bad news and I have good news. And I asked him, well, what's the bad news? And he said, the bad news is I lost my library book. I looked all over the house, every place it could possibly be, and didn't find it. It's just gone. And I said, that's too bad. And I asked him, what's the good news? And he said, the good news is it wasn't overdue. So it's always good to find a silver lining to every dark cloud. My son knew that at an early age. And I'm happy to say that I have some better silver linings to offer today. Just to kind of cut to the chase, one of the key points we'll be making today is that during the coronavirus emergency, many people, particularly people with low to moderate wages, are going to be able to receive more money through unemployment insurance than they were actually earning from work, in some cases much more. And in addition, many people, whether or not they're working or have been working, can qualify for money in the form of these economic impact payments. What I want to do today is, because I know a number of you are interested in public benefits in general and may want to know how to integrate information about unemployment insurance into your work, I'm going to be talking about general rules regarding unemployment insurance in regular times. But we'll also be talking in detail about changes that were made by the CARES Act, the huge $2 trillion federal law that passed a few weeks ago that greatly expands eligibility for and payment amounts for unemployment benefits for many Americans affected by the COVID-19 emergency. So if you're only interested in the changes made by the CARES Act, I will point out when those are being discussed. They're mentioned on the slides. And the economic impact payments were also made possible by the CARES Act, and we're going to cover those toward the end of the presentation. So first, a quick overview of unemployment insurance. Unemployment insurance is designed as a temporary benefit to provide just partial replacement of income to people who lose their jobs through no fault of their own. It's not designed to be very long-term. It's designed basically to just tide people over while they're looking for other work. It's also designed, especially during times of very high unemployment, such as the one we've just entered, to help keep the economy from collapsing by making sure that consumers have money to spend. So unemployment insurance is a joint federal-state program. The federal government sets up guidelines, and they offer within those guidelines flexibility for each state to establish certain rules and state-specific criteria that they may use. In that sense, for those of you familiar with Medicaid, it's somewhat similar to Medicaid. The state law sets some very important specifics, such as who's eligible, how much the benefit amount can be, and how long it can continue, and how earnings affect benefits if a person who's receiving unemployment goes back to work. So as I mentioned, the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act, has made a number of major changes to unemployment insurance that I will be explaining. But I'm going to start with the regular rules. Now, because those of us who are participating today are from a variety of different states, I have to be fairly general about the criteria, so you won't be getting really state-specific information here of necessity. But the regular rules for unemployment insurance regarding eligibility say that people have to have worked in a type of employment that's either covered under their state unemployment insurance law or that's covered by a federal mandate. And I can tell you that the overwhelming majority of people who are working for wages or salaries are covered by unemployment insurance. They also have to have lost their job through no fault of their own. They also need to be ready, willing, able, and looking for work. So they're going to be involved in an active job search. They have to be willing to accept suitable work if they get offers. And they're usually going to be required to register with their state workforce agency, specifically their local American Job Center, for help with their job search. Now, during the COVID-19 emergency, the usual work search requirements are being waived by a number of states temporarily for unemployment benefits that are applied for. They call it filing a claim, that are the result of COVID-19. And this makes sense when you figure that the unemployment rate is expected to skyrocket. And I think they realized, if unemployment is going to be rapidly increasing dramatically, it doesn't make a lot of sense to force people to keep looking for jobs that just don't exist. Now, once a person is approved for unemployment benefits, they need to check in weekly. They need to request benefits on a weekly basis. Very important point. Many of us familiar with other benefits, like benefits from Social Security and food stamps and others, are used to people being able to get benefits, and then periodically, maybe once a year, they have to go through a review of eligibility. But with unemployment benefits, you have to check in every week to continue your benefits. Also, to be eligible for unemployment under the regular rules, a person has to have worked a certain amount, a certain number of hours, or acquired a certain amount of earnings from work during a period called the base period. Now, in most states, the base period is going to be the first 4 of the last 5 calendar quarters that were completed before the date the claim was filed. That probably sounds a bit confusing. Let me give an example that I think will clarify it. If we were in a period of the regular rules, exclusively right now. And if a person filed their claim, applied for unemployment today, any day in April, first we'd look at, okay, what were the last 5 completed calendar quarters? Well, the last completed calendar quarter was the one that ended March 31st. January through March would be the 5th of 5 completed calendar quarters. And the first 4 of the last 5 completed calendar quarters would have been the 4 quarters of 2019, from January through December 2019. The base period then is going to be the first 4 of those 5 calendar quarters, namely the 4 quarters of 2019. And that's the period that the Unemployment Insurance Agency is going to be looking at when they decide if a person has earned enough or worked enough hours to meet the requirement. Now, some states will provide an alternate base period. They'll say, well, if you didn't have enough work during the regular base period, the first 4 of the last 5 completed quarters, then we'll look at a different base period, such as the last 4 completed calendar quarters. But that's only in some states. So the takeaway here is you need to have worked and earned a certain amount or worked a certain number of hours during the base period. Now, in some states, some part-time workers are eligible. But in most states, 27 of them, you have to have been working full-time, and you have to be looking for full-time work in order to qualify for unemployment insurance. Now, anybody who becomes unemployed can apply for benefits, can file a claim. But of course, just filing a claim doesn't guarantee your eligibility any more than applying for other benefits guarantees your eligibility. But it's worth a try. Sometimes, even when people might not ordinarily be eligible, they can be, because there may be certain exceptions. For example, in many states, employees of churches and other religious organizations are not required to be covered under unemployment insurance law. Their employers, the churches, the religious organizations, don't have to get unemployment insurance for them. But some churches and religious organizations, as part of their humanitarian mission, will go ahead and get unemployment insurance coverage for their employees, even though they're not required to by law. So those workers could be eligible for unemployment if they become unemployed. So it's always a good idea to advise people who may possibly be eligible, become unemployed, to go ahead and file a claim. So generally, a worker has to be unemployed through no fault of their own. But people are not eligible, or they may have certain penalties, delays in when they would become eligible. For example, if they were fired for misconduct, misconduct generally needs to be proven by the employer, the former employer, to the satisfaction of the agency that administers unemployment insurance in the state. But the worker has the opportunity to counter the employer's argument and argue their own case that they did not commit misconduct. Or if the person quit a job without good cause, they wouldn't be eligible. So generally, they'd have to have good cause that related either to the nature of the work or problems with the employer. And good cause is something that state law, state unemployment insurance law, can clearly define. If a person is unemployed and refuses a suitable job offer, they may be found ineligible for unemployment or no longer eligible. And if they're not able to work or available for work, they'll be found ineligible. Now, there are some workers who are generally not covered by unemployment insurance at all. And they include self-employed workers, a pretty large pool. I'd say that maybe the majority of workers who are not covered under the regular rules for unemployment insurance. Certain workers employed by their own families, elected officials, politicians, legislators, judges, members of the judiciary, and members of the state National Guard are generally not covered by unemployment insurance. But as you'll see when we talk about the rules that the CARES Act initiated, that's going to change in a big way, particularly for self-employed workers. Now, how much can a person get from unemployment? Well, the rules are different among different states, but usually, on the average, unemployment insurance will replace about half of a worker's after-tax earnings up to a certain maximum benefit amount. So again, this does differ from state to state, but usually you'll get a benefit amount that's equal to about half of your take-home pay, your after-tax earnings, but there is a ceiling on how high it can be. So your unemployment benefit will be either about half of your after-tax earnings or the maximum amount for the state, whichever is less. Now, the maximum benefit amounts for different states, I haven't researched what they all are, but I can tell you I just did this training for Missouri earlier today, and their maximum benefit is $320 per week. In Maryland, it's $430 a week. In New York, it's a little over $500 a week. So there's a fair amount of variation. Now, some states will increase workers' unemployment benefit if they have dependents. They may give an extra handful of dollars per week for each dependent they have up to a certain maximum. But usually the maximum benefit for the state is going to be the total benefit, including any of the increases for dependents. And benefits can last up to 26 weeks. In most states, there are some states that offer fewer, some that offer more. Missouri only offers 20 weeks under regular rules, and Massachusetts offers 30 weeks, for example. But most states, it's 26 weeks, which is 6 months. Okay, we're going to talk about the changes made by the CARES Act now, but first, any questions so far, Dallas?
I don't see any yet.
Okay. All right. Well, now we're getting to the important part. What's happening as a result of the CARES Act? So the CARES Act is providing additional unemployment assistance in 3 ways for states that enter into agreements with the federal government to use these rules and accept money made available through the CARES Act. I would bet a substantial amount that every state will enter into an agreement with the federal government because the money and the benefits provided by the CARES Act are too good to pass up. So the 3 ways that the CARES Act improves unemployment benefits are: number 1, it expands the pool of workers who are eligible for unemployment. It makes certain workers eligible for unemployment who would not be eligible under the regular rules. Secondly, it provides a higher weekly benefit for those same workers as well as a higher benefit for workers who are eligible for unemployment benefits under the regular rules. And finally, for workers who were eligible for regular unemployment, but exhausted their benefits, used up their usually 26 weeks worth of benefits, it lets those workers continue to get unemployment for a longer period and at a higher level. So we'll go into details now. I'm going to spend some time covering this, and then I'm going to break after I summarize the changes made by the CARES Act for questions, because I imagine you may have some at that point. So the first program is called Pandemic Unemployment Assistance. And this is a benefit that's entirely federally funded. It's separate from unemployment insurance. It's just federally funded assistance provided to some workers, but it is separate from the unemployment insurance program. And this is the benefit that's provided to people who would not be eligible for unemployment insurance under the regular rules. And I quoted this from the CARES Act. It says that to be eligible for this assistance, a worker has to be unemployed, partially unemployed, or unable or unavailable to work for at least one of a series of reasons related to COVID-19. There are 10 specific reasons. A person has to satisfy at least one of them to be eligible, and we're going to start look at those in a couple of slides. But first, I wanted to tell you who may be eligible for pandemic unemployment assistance who's not eligible for unemployment insurance under the regular rules. And that's going to be, first of all, and probably most importantly, self-employed people. So that's people who are self-employed and have conventional businesses. It includes independent contractors, freelancers, and even gig workers. So it includes some people who are technically self-employed, but who might not even consider themselves to be self-employed. Independent contractors, may very well be working for a single employer, think of themselves as employees, but they are generally classified as self-employed because they're not on the regular payroll, their employer isn't taking taxes out of their pay. Freelancers, gig workers as well. My daughter was a caregiver, basically a nanny for a family, until a few weeks into the coronavirus emergency when she was laid off. She was self-employed, but clearly a gig worker, and she will be eligible for pandemic unemployment assistance. Workers who are only looking for part-time work. Remember, in most states, you have to be looking for full-time work to be eligible for unemployment insurance, but people who are looking for only part-time work may be eligible for pandemic unemployment assistance. Workers who don't have enough work history to qualify for unemployment insurance under the regular rules. So in other words, they haven't earned enough during the base period to qualify for unemployment under the regular rules. Maybe they just recently started working, for example. They can still be eligible for this assistance. And the law says people who would not otherwise qualify for unemployment insurance. It doesn't specify what that means, but it seems to be fairly open-ended. So, a person needs to be unemployed, partially unemployed, or unavailable or unable to work for at least one of the following 10 reasons related to COVID-19. And I'm going to go through them one at a time because they're important. Number one is being diagnosed with COVID-19 or having symptoms of COVID-19, but you're awaiting a medical diagnosis. So that's pretty clear cut. Number two, having a household member diagnosed with COVID-19, also pretty clear cut. Or caring for a family member or another household member who's diagnosed with COVID-19. Fourth, being unable to work because you have to care for a family member or a household member who can't go to the facility where they get services or care during the day, and therefore you have to stay home and take care of them. So this is certainly going to apply if you have a child or more than one who's out of school because the schools are closed due to COVID-19, or who can't go to their daycare because of COVID-19 because they're closed, or perhaps an adult with a disability who goes to a day program, but the day program is closed due to COVID-19, so you have to stay home with them. Okay, the fifth is you can't go to your workplace due to a quarantine related to COVID-19. That's pretty straightforward as well. Six is you can't go to your workplace because a healthcare provider said that you should self-quarantine. Seventh, this is one I wanted to emphasize because I've already had several people ask me about it very recently. Suppose you were offered a job, you were scheduled to start, and then the COVID-19 emergency occurred and the job was withdrawn, or for whatever reason, you no longer have a job because of COVID-19. So you might not have even been able to start the job, but you had an offer, and due to COVID-19, you no longer have that job. You could still be eligible for pandemic unemployment assistance, even if you never actually had the chance to start the job. Number 8, you've become the household's breadwinner or primary support because the head of the household died from COVID-19. Number 9 is a really big gray area in the law. It says that you had to quit a job as a direct result of COVID-19. But unfortunately, the law says nothing about specific reasons that a person might quit related to COVID-19 that would justify pandemic unemployment assistance. Now, some key members of Congress have indicated that Congress did not intend this to be an open-ended way for people to get unemployment assistance if they simply felt that they would be safer being in less contact with other people if they quit their job and stayed home. Unfortunately, because this has not been tested at all, this is brand new, I can't give you specific examples of when a person quitting a job because of COVID-19 might be considered justifiable under this number 9 reason. But I'm imagining at a minimum, there would have to be a particularly compelling reason that the person quit the job due to COVID-19, such as they were of such an age and maybe had such underlying health conditions that it made them an extremely high risk to contract COVID-19 and likely die from it. But again, this is all speculation. This has not been tested yet. And number 10 is the easiest one that I think is going to apply to lots of people. The workplace is closed due to COVID-19. So many businesses are shuttered now. Many laid off workers are going to qualify based on this one. Okay. Now, wanted to cover a detail that some people have asked me about. Remember, I'm going to flip back so you can see that the law says you have to be unemployed, partially unemployed, or unable or unavailable to work for one of those 10 reasons or more than one of those reasons. I want to talk about this partially unemployed criterion. When might that apply? Well, I work with lots of food vendors who are self-employed, and I provide benefits assistance to them. And many of them operate at different locations, at more than one location. So they might have vending machines in one location and operate a cafe in another, and maybe a self-service food area in a third location. Well, if a self-employed person, let's say, has one of their multiple locations shut down due to COVID-19, they can't operate the portion of their business at that location, but their other locations are still operating, then they could most likely be determined to be partially unemployed for reason number 10. The workplace is closed due to COVID-19. Okay. I can also imagine some workers who might not be self-employed, who might be partially unemployed for one of these reasons. Maybe they have to stay home with their kids who are off school, and they can only go to work for a portion of their regular hours. Their employer still keeps them on. They still get paid the full wage for the hours they do work, but because they have to care for a child at home who can't go to school or to daycare because the schools and the daycares are closed due to COVID-19, they would be partially unemployed, but not completely unemployed, and they would meet one of these criteria, namely number 4. Okay. Now, there are 2 conditions a person cannot meet if they want to be eligible for pandemic unemployment assistance. They can't be able to telework for full pay, and they can't be receiving paid sick leave or other paid leave. Now, let's say that a person is able to telework, but they can't telework for full pay. Maybe their employer says, well, you know, some of your duties you have to be here in the workplace to perform, but others you could do remotely. So I'm going to let you telework to do the duties that you can do from home, but you'll only get paid for those. You won't get paid the full wage for your job. Well, you could argue then that that person was partially unemployed due to COVID-19. They would have met at least one of those conditions. And because they were partially unemployed, still getting some pay, but not all of it, they could qualify for pandemic unemployment assistance. Now, one question that may come up about the paid leave is, well, suppose you start out with paid leave, but then it runs out. And the answer to that question would be, once it runs out, then you could qualify for pandemic unemployment assistance. Another question that may come up is, well, do you have to use up all of your paid leave before you can get pandemic unemployment assistance? And the answer is, the law does not say anything about that. The federal law, the CARES Act, simply says you can't be eligible for pandemic unemployment assistance if you are receiving paid sick leave or other paid leave. It does not say you have to exhaust all your paid leave to be eligible for pandemic unemployment assistance. But I imagine different states are going to adopt different policies on this, and you'll need to check your own state's unemployment insurance website to get more details. So how much is the benefit that you can get from pandemic unemployment assistance? This is the really good part. So pandemic unemployment assistance will provide a cash benefit in two parts. Some states may provide the benefits in two separate payments. Some may combine the two parts into a single payment. But the first part of the payment is going to be a cash benefit that's at least half of the average regular unemployment insurance benefit for the state. The second part is an additional flat $600 a week for everybody who's eligible, and that's funded by the CARES Act, that extra $600 a week, until as late as July 31st. So if the person remains eligible the whole time, they could get it right through the end of July. And this benefit is going to be provided retroactively. In a few states, I've run into it, it's retroactive to March 29th if the person was eligible that far back. The CARES Act actually enables a state to go back as far as January 27th. I don't know how likely it is that states will go back that far, but some states are still gearing up their unemployment insurance systems to accommodate the new rules and haven't even started accepting new claims for pandemic unemployment assistance. But once they do, those benefits can be significantly retroactive. So think about how much money we're talking about here. The average unemployment insurance benefit for a state is almost certainly going to be over $100 a week. And in some states, it may be well over $200 a week. And in all states, people will be eligible for the extra $600 a week. So you're talking about people being able to get over $700, $800, $900 a week for a period of several months. That is very likely much more than many people you're serving are earning in their jobs or were earning in their jobs before COVID-19 struck. How long can this last? Up to 39 weeks, which is 9 months. But the program ends December 31st, 2020. So the benefits, the pandemic unemployment assistance will last either up to 9 months, or will last up to 9 months, but not longer than December 31st. So if, let's say December 31st, you've only used up 8 months, your benefit is still done. And while the benefit of at least half the average unemployment insurance benefit for the state can last through the end of December, the extra $600 a week only lasts through the end of July. So that's pandemic unemployment assistance. The second way that the CARES Act expands unemployment benefits is through something called pandemic unemployment compensation. See, rule number one for bureaucrats trying to confuse the public is to give different programs very similar names. We had pandemic unemployment assistance. Now we have pandemic unemployment compensation. I wish they'd give them very different names so you could tell them apart, but I only explain the rules, I don't make them. Anyway, pandemic unemployment compensation is the benefit for people who do qualify for unemployment insurance under the regular rules. And it says, okay, if you get regular unemployment insurance, we will also give you the extra $600 a week cash benefit until as late as the end of July. And then finally, the third way is called pandemic emergency unemployment compensation. Try to keep those three names apart. And this is the one for people who have qualified for regular unemployment insurance, but used up their full 26 weeks or however many weeks were available. What it does is it gives people up to 13 weeks, up to 3 extra months of continued benefits. And they'll be able to get the same amount of unemployment insurance that they received when they were getting it under the regular rules before they exhausted it. Plus, they'll also be able to get the extra $600 a week. And I apologize, this says through July 25th. It should say through July 31st. There's one adjustment from the Missouri training that I didn't make when I made this more generic. In Missouri, they're only allowing it through July 25th for some reason, but this should say through July 31st. To qualify for the extra 13 weeks of benefits and the extra $600 a week through the end of July, a person must be able to work, available for work, and actively seeking work, which is the criterion for regular unemployment insurance as well. And like the other two programs, this one ends December 31st of 2020. So if a person hasn't used up all of their extra 13 weeks by the end of December, that's too bad. They're done anyway. Okay, and I'm going to pause now because I imagine there's some questions. Anything in the chat, Dallas?
Yeah, this is more of a general question. Jackie wants to know if the PowerPoint will be available after the webinar for printing out and viewing.
Yes, thank you for asking that question, Jackie. When you receive an email sometime after the presentation, not sure how long it will take, but you will get one. You'll receive the PowerPoint, and if there are any questions I did not have time to answer during the webinar, you'll also receive a written document with the questions and answers that I get to during the webinar. And both documents will be attached to that email. Everyone who registered will receive it. Any other questions?
Can we ask a question?
Well, I'd prefer if you could do it in the chat, please. I thought everybody was on mute. But, yeah, in fairness, I don't want to open it up. We've got too many people on the webinar to open up to voice questions. But please feel free to type any question you'd like into the chat. Do we have any others, Dallas?
Yes, here's one from Gail. What about a person who was afraid to go to work due to the virus, is what she asked.
Yeah, that's a good question, Gail. And I think what you're referring to is the pandemic unemployment assistance and whether that person would meet one of the 10 conditions that they'd have to meet at least one of in order to be eligible for pandemic unemployment assistance. And the one I think you're referring to is number 9. The person had to quit a job as a direct result of COVID-19. But I noted in parentheses here, but not only due to fear of risk. So unfortunately, as I mentioned earlier, the CARES Act does not give any examples or any clarification about what kinds of circumstances would justify a person quitting a job as a direct result of COVID-19. So that's going to be up to states to determine, and they have absolutely no experience with this yet at all. So I can't really say, but what I can say, to repeat a comment I made earlier, is that members of Congress have said that they did not intend this to mean a person quit a job just because they thought that they'd be safer being at home rather than going to work. And I'm assuming that that means the person would have to have an even more compelling reason, like perhaps underlying health conditions, autoimmune disorders, asthma, chronic obstructive pulmonary disease, perhaps their age, they're well over 60, made them a higher risk. But that's just speculation on my part. We have no track record on which to base that. So sorry I couldn't give you something more definitive. Any others? Dallas?
Yes, this one is from Marcy. What about someone that would have qualified due to a doctor having him quarantined because of being high risk that applied for disability instead of unemployment? Should he try to switch to unemployment?
Okay, that's a good question. And I'm going to talk more about Social Security disability and unemployment insurance a bit later. We are going to cover that in a handful of slides. But what I'll say right now is a person may, in many states, be eligible for both at the same time. They could apply for unemployment insurance and for Social Security disability. They could quite possibly receive both. But I'll give you a bit more detail about that when we get to the Social Security disability slides. It's a good question. Any others, Dallas?
Yes, Kenya would like to know if a company files UI for a client, does the client need to also file if the person stopped working as an underlying condition?
Could you read that once more? I didn't quite pick up on it.
Sorry, it's a little, there might be a typo in there or something. If a company files UI for a client, does the client need to also file if the person stopped working as an underlying condition? So,
okay, I think it sounds like you have an interpretation of that question.
Yeah, I think she's asking if a company files unemployment insurance for a client, does that client then also need to file for unemployment insurance themselves, him or herself, if they stopped working? I think, correct me if I'm wrong, Kenya.
Yeah, and I was interpreting it a little differently. Now, we're going to talk about how to file a claim. That's the term they use for apply for unemployment insurance a little bit later. But it's up to the individual to file a claim, to apply for unemployment insurance. They could be assisted by someone else. But it's not as if someone else would be acting independently. If somebody's assisting a person to apply for unemployment insurance, it's technically the individual who's applying, albeit with assistance from someone else. Now, I was interpreting the question a little differently. I was wondering if the question might have had something to do with the fact that we're talking about different kinds of benefits here. We're talking about regular unemployment insurance. We're talking about pandemic unemployment assistance. We're talking about the two other programs that provide, larger regular, a larger benefit, the extra $600 a week for people who are eligible for regular unemployment. We're talking about the pandemic emergency unemployment compensation that gives people an extra 13 weeks of benefits and the extra $600 a week. And when a person applies for unemployment in the current environment, presumably on their state's unemployment insurance website, there's going to be a single application for unemployment, but it's going to ask questions that will enable the unemployment insurance worker to figure out which of the programs the person may be eligible for. They'll probably start by looking at whether the person could qualify for regular unemployment insurance. And if they were eligible, then they could also get the pandemic unemployment compensation, the extra $600 a week. If they weren't eligible for regular unemployment insurance, then they'll be looking at whether they could qualify for the pandemic unemployment assistance. But it should not be the case in any state, I would think, that a person has to figure out which one they may be eligible for and apply specifically for that program. I think it'll be a single application, and the worker will evaluate the person's eligibility for any of the programs. But Kenya, if you'd like to clarify the question, if I didn't answer it, please feel free. Any others, Dallas?
No, I think that's it. I don't see any more.
Okay, all right, great. We'll move ahead then. So how do you apply for unemployment insurance or file a claim? What you want to do first is find your state's unemployment insurance website. And if you go to the link on this slide, www.servicelocator.org/OWS links, .asp, this lets you enter your state, the name of your state, and it will provide you with a link to your state's unemployment insurance website. Now, once you've found the website, most states allow claims to be filed online or by phone. Currently, if it's possible to file online, that's the way to go, because the phone lines, as you can imagine, with mega millions of people applying for unemployment, the phone lines are totally jammed. So it's definitely a good idea to file online. Now, some states under ordinary circumstances may require a person to file in person. It would usually be at an American Job Center, but I can't imagine that that's the case under the current emergency for obvious reasons. And some states may require people to register for work through their American Job Center or Employment Service Office. But as I mentioned earlier, many states, most, possibly all of them, are waiving the work search requirement for claims filed due to COVID-19, at least temporarily. But you'd have to look at your own state's information to determine that. So once your claim is approved, how long does it take to get benefits? Depending on the state, it's usually 2 or 3 weeks, maybe slightly longer. But I think given the huge volume of claims that they're handling in every state now, it may very well take longer than that. But as I mentioned, the benefits can be provided retroactively if the person was eligible throughout the retroactive period. Okay. Now, there are some states that have a 1-week waiting period. What these states will say is, okay, go ahead and apply as soon as you become potentially eligible. You lose your job, for example. But we're not going to give you a benefit for the first week that you're out of work. We'll make you wait until the second week you're out of work before you'll get an unemployment insurance benefit. This is under the regular rules. However, that waiting period in states that have it is generally being waived for claims that are related to COVID-19, because the CARES Act actually provides an incentive for states to waive that week-long waiting period. And many states don't have the waiting period anyway to begin with. Now, if a person is approved for benefits, they don't have to just go through a redetermination of their eligibility once a year, the way they do with many other public benefits. They actually have to interact with the system every week or every 2 weeks. Generally, they're going to do this online, sometimes by phone or mail, but they have to request benefits, every week or every 2 weeks. So it's a pretty labor-intensive process. Now, it's also the case that after you file a claim, while you're waiting a few weeks, possibly longer, to get approved, although this is kind of contrary to it's not intuitive, you wouldn't think you'd have to do this, but you have to go ahead and request payments every week, even before your claim has been approved. Otherwise, you wouldn't be eligible for payments after the initial claim until you went ahead and made your weekly claim. So as soon as you file, every week after that, you want to go back in and file a weekly or a bi-weekly claim, depending on your state's rules, whether it's once a week or once every 2 weeks. Now, if you are getting unemployment benefits and you find a job, maybe you're working a temporary part-time job, or you get any job offers, or you refuse any job offers, you need to report that during your weekly or bi-weekly claims, your payment requests. Unemployment insurance benefits are taxable. This is a really important point. And I highly, highly, highly recommend that anybody who gets unemployment insurance or other unemployment benefits through the CARES Act choose the option they have to have taxes withheld from their unemployment benefits. Very important, because if you choose not to have taxes taken out of your unemployment benefit and you're getting a large benefit through the end of July and possibly a smaller benefit beyond that, at the end of the year, remember, your unemployment benefits will be taxable. If you haven't had taxes taken out of the benefits, then you may end up with a big tax bill that you can't afford if you've spent all your unemployment insurance benefits and other unemployment benefits by the end of the year. So I definitely encourage anybody who files for unemployment to choose to have taxes taken out of their benefits. So suppose you're getting unemployment benefits and you go back to work. Well, usually part-time earnings will reduce your unemployment benefit, not dollar for dollar, but not much less than dollar for dollar. There's not a big incentive for people to go back to work part-time. You might be able to keep maybe the first $40, $50 a week, that this may differ from state to state, out of those part-time earnings. But the additional earnings you get will cause your unemployment benefit to be reduced dollar for dollar. Now, if you go back to work full-time, your unemployment insurance benefit will generally stop. And that makes sense, because unemployment is only designed to be temporary, to tide people over until they're able to go back to work full-time. Now, if you do go back to work, whether part-time or full-time, you have to promptly report your earnings. And you do that with your weekly or bi-weekly filings, your payment requests. Okay, and now we're going to talk about how unemployment interacts with SSI and Medicaid, and then how it interacts with Social Security, Disability, and Medicare. And then I'm going to break for more questions. So I would imagine most of you are familiar with SSI, stands for Supplemental Security Income. It's a benefit that people receive if they're either disabled or they're at least age 65, and they have little money. They have low income and low assets, also known as resources. In most states, if a person gets SSI, they're automatically eligible for Medicaid. In the remaining states, people on SSI are usually eligible for Medicaid, even though it may not be automatic. SSI is considered a benefit of last resort. In order to be eligible for it, or in order to remain eligible for it, you have to agree to apply for and accept any other benefit that you may be entitled to, and that includes unemployment benefits. So a person on SSI who becomes unemployed and potentially eligible for unemployment benefits is required to apply for them. The SSI rules say they have to. Now, if a person receives unemployment insurance benefits, they are considered unearned income. And unearned income reduces SSI almost dollar for dollar. The first $20 of unearned income doesn't reduce the SSI, but any amount over $20 a month reduces the SSI dollar for dollar. Now, if a person's if the person's unemployment insurance benefit is high enough, then that it will reduce their SSI to 0 and their payment will be suspended. And generally, that means their Medicaid would stop. But one thing to note is that if a person on SSI has worked long enough, they might qualify for SSDI, Social Security Disability Insurance, which could likely provide them with a higher cash benefit than SSI did. And also, if a person's Medicaid would ordinarily stop after their SSI was suspended due to unemployment benefits, there may be at least one and maybe more than one way that they could qualify for Medicaid. SSI is only one of the ways that you can qualify for Medicaid in most states, but there are usually dozens of different ways to qualify for Medicaid. So if a person doesn't get Medicaid in one way, they lose eligibility because their SSI was suspended, they may be able to get Medicaid another way. And the other ways that they could qualify differ greatly from one state to the next. But one way that many people can qualify, if they have even just a little bit in earnings, is through a program called a Medicaid buy-in. There are 45 states that have these programs, and they're designed to provide Medicaid for working people with disabilities who meet certain other criteria. So if a person's SSI stopped because of their unemployment benefits, but they went back to work, in most states, there's no minimum amount they have to earn. So even if they earn just a little bit of money, they could potentially get their Medicaid back through their state's Medicaid buy-in program. So far we've talked only about the usual rules about the interaction between unemployment insurance, SSI, and Medicaid. But now I wanted to tell you about an important change that was made by a different federal law that passed in the wake of the coronavirus emergency. That law is called the Families First Coronavirus Response Act. And this law, among many other provisions, provides a protection for Medicaid for people during the COVID-19 emergency. So suppose a person's Medicaid would ordinarily stop because their SSI was suspended as a result of their unemployment benefits. This law will almost certainly enable them to keep Medicaid despite the fact that their eligibility would ordinarily stop, until the end of the coronavirus emergency. Okay, so here's how it works. The Families First Coronavirus Response Act said, okay, we want to help out states by giving them more federal money for their Medicaid programs. In every state, Medicaid is a state and federal partnership. The federal government contributes a percentage of the money, the state pays the rest. And the amount, the percentage that the federal government pays can differ from state to state. But what this law, the Families First Coronavirus Response Act, says is, okay, states, we're going to offer you up to 6.2% more of the federal contribution for Medicaid, so your state can pay a lot less of state money for Medicaid. But if you choose to accept that money, you have to meet certain conditions. And the most important one for our purposes is that if any person in your state is receiving Medicaid at any point during the COVID-19 emergency, then they have to be eligible to keep Medicaid until the last day of the month that the COVID-19 emergency is officially called off. By the way, when I'm referring to the COVID-19 emergency, I mean as declared by or rescinded by the federal government, specifically the Secretary of the Department of Health and Human Services. So let me give an example of what I'm talking about. So let's say a person was getting SSI and Medicaid, and then they began to receive unemployment benefits at some point during the coronavirus emergency. And as a result, their SSI stopped, and usually their Medicaid would stop as well. Under this law, the state has to continue that person's Medicaid until the COVID-19 emergency ends, specifically until the last day of the month that the emergency is called off, even though they would not ordinarily be eligible for it. They'd have too much unemployment income. Okay, so it's a nice protection that's going to enable people to keep Medicaid at least through the end of the coronavirus emergency, even if they wouldn't ordinarily be eligible. Now, there's another rule that appears in the CARES Act that applies to that extra $600 a week unemployment benefit that people will be receiving. The extra $600 a week is not counted as income for Medicaid or for the Children's Health Insurance Program, which is another form of Medicaid. So while the $600 a week extra unemployment benefit does count as income for SSI and certain other programs, it doesn't count as income for Medicaid. Now, suppose that at the end of the COVID-19 emergency, somebody still has enough unemployment benefit to stop their SSI, even after the extra $600 a week has ended. They're still getting enough unemployment to reduce their SSI to zero. Well, they may still be able to do a little bit of work and qualify for their Medicaid through the Medicaid buy-in program in their state. And finally, and this is for those of you who are wonks and know about the SSI work incentives, there is a work incentive in the SSI program called PASS. That stands for Plan to Achieve Self-Support. It's a work incentive designed to enable a person to reach a work goal by helping them pay for expenses to reach the goal. And what a PASS does is it lets a person get keep more SSI than they would ordinarily receive, or in some cases even initially qualify for SSI if they would otherwise have too much income. And while people are receiving these big unemployment benefits, they could potentially spend a good chunk of that money on expenses to reach a work goal and use a PASS, a plan to achieve self-support, to get or keep SSI, and therefore keep Medicaid as well. So I'm going to do a couple of examples of the interaction between unemployment and SSI. The first one is going to be for a person who's using the regular rules, not during the COVID-19 emergency. The second one will be a person who's receiving benefits, unemployment benefits, during the coronavirus emergency. So first, Shaniqua, we're going to look at her situation pre-COVID, so not CARES Act rules. She received $240 a week gross wages. That's an average of $1,040 a month, and an average of $305.50 a month SSI. When a person works, their SSI is usually reduced. Not dollar for dollar, but it is reduced. So with earnings of $1,040 a month, Shaniqua's SSI goes down in her state from the maximum $783 a month, which is the maximum in most states, to only a little over $300 a month. Now, she worked for 2 years, was then laid off through no fault of her own, applies for unemployment insurance, and gets a benefit of $110 a week, which averages out to $477 a month. And the question is, what will her average SSI payment be while she receives unemployment insurance? And the answer is, in her state, $326 a month. Remember, I said that the first $20 of unemployment benefits, which are considered unearned income, don't reduce SSI, but every dollar over $20 a month reduces the SSI dollar for dollar. So she's getting $477 a month unemployment insurance. We subtract the first $20 of that, that leaves $457 a month, and that's the amount that her SSI is reduced by. So her SSI goes down to $326 a month. And what will her average total income be before taxes? It's going to be $803 a month. She gets $477 a month unemployment insurance and a reduced SSI payment of $326 a month. So that's a total of $803 a month, which is exactly $20 more than the maximum SSI benefit in Shaniqua's state. The extra $20 comes from that $20 deduction from the unearned income. So Shaniqua would be able to keep some of her SSI and her Medicaid, and she'd have the unemployment insurance as well. But now let's look at Pedro, who got a full SSI payment before he started work. He started a job 3 years ago, and he worked full-time. He earned $440 a week gross wages. That's an average of $1,905 a month gross wages. And that meant his earnings were high enough to reduce his SSI to 0. But there's another great work incentive in the SSI program that Pedro is eligible for. It's called 1619B. And 1619B says, if your earnings cause your SSI to go down to 0, and you meet a few other conditions, you still stay eligible for SSI. That does two things. Lets you keep your Medicaid, and it lets you get your SSI back just by calling Social Security if anything happens to your job later, if your earnings drop low enough or you stop work. It's a great double safety net. So in other words, Pedro is not receiving an SSI payment, but he's still eligible for SSI. So he's keeping his Medicaid, and he could go right back on SSI if anything happened to his job and he didn't have any other income. But now things change for Pedro. He's laid off due to the COVID-19 emergency. So he applies for unemployment insurance. Based on his work history during the base period, he's approved for a weekly unemployment insurance benefit of $187 a week. Plus, thanks to the CARES Act, he gets that extra $600 a week. So he's getting a total unemployment benefit of $787 a week. That works out to $3,408 a month. So he's getting a lot more money from unemployment, at least through the end of July when the extra $600 a week stops, than he was receiving working full-time. Remember, his average gross wages working full-time were $19.05 a month. Now, without working at all, just getting unemployment benefits, he's getting over $3,400 a month. So two questions: how much SSI should Pedro get, and what should happen to his Medicaid? Well, his SSI is certainly going to go down to zero. With over $3,400 of unearned income, that's going to reduce his SSI easily down to zero. And the problem here is that his SSI is stopping not due to earnings, but due to unearned income. Unemployment insurance is unearned income. And when somebody's SSI stops because of unearned income, then they're not eligible for 1619B. So he's not going to keep his Medicaid. He's not going to keep his SSI eligibility. So in this case, ordinarily, his Medicaid would stop. But remember, Pedro was still getting Medicaid when the coronavirus emergency started. So if his state wants that extra federal money for Medicaid, and I would wager that every single state is going to choose to get that extra money, the state has to continue Pedro's Medicaid at least until the end of the COVID-19 emergency, even though he is no longer technically eligible for it due to his unemployment income. Okay, and I wanted to mention the interaction now between Social Security disability benefits and Medicare and unemployment benefits, and then I'm going to stop for questions. So if a person's eligible for unemployment insurance and they get unemployment benefits, they're receiving Social Security disability, the unemployment benefits have no impact on their Social Security disability. Their Social Security disability will not be reduced, it won't be stopped because of their unemployment benefits. And on the flip side of that, in all but 4 states, a person's unemployment benefit will not be reduced if they get Social Security disability. So in almost every state, a person can be getting full unemployment benefits and full Social Security disability benefits if they're eligible for both. Neither one will reduce the other. Now, if a person continues to get their Social Security disability and they're getting Medicare, their Medicare will continue as well. I wanted to mention that in some states, some unemployment insurance workers may use the fact that a person's getting Social Security disability in order to argue, well, if you're getting Social Security disability, that means you can't work. If you're not able to work, you don't qualify for regular unemployment insurance benefits. So remember, you have to be ready, willing, able, and looking for work to qualify for unemployment insurance under the regular rules. If a person is denied unemployment insurance because they're disabled or because they're receiving Social Security disability, they should appeal, because that's not a legitimate argument, not a legitimate reason for them to be denied unemployment. So we're going to go through one more example and then we'll break for questions. So Cecilia gets $920 a month of SSDI, Social Security Disability Insurance. She's worked in her job for 5 years, earns $280 a week gross wages. That's $1,213 a month on the average. She's laid off due to COVID-19. She applies for unemployment insurance and gets $120 a week. In Cecilia's state, although this is not true in every state, in fact, slightly more than half states it's not true, her state allows part-time workers to be eligible for unemployment insurance. So she gets a benefit of $120 a week. And because it's during the COVID-19 emergency and it's before the end of July, she's also getting the extra $600 a week. So she's going to get a total of $720 a week of unemployment benefits for a total of over $3,100 a month. So the questions are, should Cecilia continue getting SSDI? And if so, how much? And how much total monthly income should she get? And the answer is yes, she should continue getting SSDI, the full amount, $920 a month, because unemployment benefits have no impact on Social Security disability. And then how much total monthly income should she get? The answer is a lot. She'll get her full $920 a month SSDI and $3,118 a month unemployment benefits for a grand total of $4,038 a month. This is a nice windfall for people who are used to earning a lot less than this amount in their jobs. Although I didn't mention this on any of the slides, I did want to point out that because many people are going to be getting such a big windfall, but only for a few months until the end of July, and because we don't know how long the coronavirus emergency will last, let alone how long it's going to take for unemployed people to be able to go back to work, I strongly advise anybody who gets unemployment during the COVID-19 emergency, especially these large amounts before the end of July, to get help if they need it, to set up a budget and save some of that money. They may need it after the end of July. Okay, and I think we're ready for some questions, Dallas, if there are any in the chat.
Yeah, sure. We have a lot, actually.
Okay.
Let me see here. So these first two are kind of similar. I'll read them one at a time, and you can tell me if there's a difference between them.
Okay.
The first one is from Nicole, and she says, if you filed and did not have taxes withheld, are you able to change that so that taxes are withheld? And then Dan asks, can you change the tax withholding after submission if you didn't select the appropriate withholding when you first filed for UI?
Yes, I agree that Nicole's and Dan's questions sound pretty much identical to me, Dallas. I agree with you. And unfortunately, I don't know the answer. And I believe that the answer might possibly differ from one state to the next. I certainly know that whenever a person files for unemployment, they're applying for it initially, they do have the option to have taxes taken out. What I don't know is whether in individual states they have the option to change their mind later. So if they filed for unemployment and they did not choose to have taxes taken out, I don't know whether, in various states, whether they have the option to later say, I changed my mind, I do want to have taxes taken out. If anyone else on the call is familiar with their state's unemployment rules and whether that's possible, please go ahead and type that into the chat, but I do not know. And next question, Dallas?
Okay, this next one is from Reka, sorry if I mispronounced that. They say some people working in retail are getting extra pay while working during Corona. Are the income limits for SSDI adjusted? A mother is concerned that the extra money will cause her child to lose SSDI payments.
Oh, that's a really good question. Unfortunately, during the COVID-19 emergency, the earnings limit for Social Security Disability, or SSDI, has not been adjusted upward. I don't have time to go into detail about this, but to greatly oversimplify, when a person gets Social Security Disability, if their earnings stay below a certain amount that Social Security calls substantial gainful activity, they may be able to keep their Social Security Disability and the full amount indefinitely. If their earnings are above that amount, and by the way, that amount is currently $1,260 a month gross wages for people who are not blind, who have any other disability besides blindness, and it's $2,110 a month gross wages for people who meet Social Security's definition of blindness. If a person's earnings go above that, they might not necessarily be doing substantial gainful activity because there are certain subtractions allowed from their earnings. And if the difference after the subtractions stays under $1,260 a month or under $2,110 a month if they're blind, then they can still keep their Social Security Disability. But if a person consistently earns above the limit, even after the subtractions, their Social Security Disability may stop. However, there are additional work incentives, additional safety nets that can enable a person to get their Social Security Disability back again fairly quickly without having to reapply if their earnings later drop or stop. So considering the fact that this, we certainly expect this to be a temporary crisis, it may be possible, even if a person's Social Security Disability stops because of the extra earnings they're getting during the emergency, that when their earnings later drop back down to the usual level, they'll be able to get their Social Security Disability back fairly quickly without having to reapply. But I definitely recommend that a person in that situation be referred to your state's WIPA project, Work Incentives Planning and Assistance. They provide free benefits counseling for people getting Social Security Disability or SSI or both, who are working or trying to work. And to get connected with the WIPA project, a person should call the Ticket to Work helpline. You can Google that and find the phone number. Okay, and next question, Dallas?
Yeah, sure. Just real quick, how much longer are you going to be answering questions? Because I have 4 left, and a few seem like they could have kind of long answers.
Well, let's take them one at a time. I'm thinking of going another 5 minutes with questions. Then we're gonna move on, and I hope, still have time for some questions at the end.
Okay. The next one is from Janet. She wants to know, does SSI make sure people apply for SSI? I'm working with someone whose rep payee doesn't want them to apply for UI because she doesn't want it to change her SNAP, housing subsidy, etc.
Yeah, I can't answer this question for certain. I did mention that a person on SSI who may become eligible for UI, for unemployment insurance, is required to apply for it and accept it if they're found eligible. But if somebody didn't apply for it, would Social Security catch them, and would there be any penalty? I can't say how likely that is. But what I can say is that a person in that situation should definitely get benefits counseling for a couple of reasons. One is so that they could understand how much more money they would have getting unemployment benefits than not getting them. And you could see from the examples we've just been through that, especially with that extra $600 a week of unemployment benefits, people will have a whole lot more money, at least through the end of July. And secondly, and probably more importantly for some people, because they need to see what the impact would be on other benefits, whether they would be better off, and especially whether they could keep their Medicaid. For many people with disabilities, Medicaid is absolutely essential. They can't do without it, not only because of medical expenses it pays for, but because it often funds support services in the community that people rely on to live independently or live outside institutions. So a benefits counselor can help a person figure out whether their unemployment is going to affect their Medicaid eligibility if they get Medicaid. We talked about the fact that they'll still be able to keep their Medicaid at least through the end of the COVID-19 emergency, but a benefits counselor could help them look beyond that and see, if they've got options to keep their Medicaid long-term. And although I understand a family's concern about having other benefits like food stamps, also known as SNAP, Supplemental Nutrition Assistance Program, about having those benefits reduced, I think if people work with a benefits counselor and they can see what their net income would be as a result of that big unemployment benefit they may be able to get, despite certain other benefits being reduced or even stopped, most of them would choose to go with the unemployment benefit. Because I'm telling you, anybody who's eligible for unemployment with that extra $600 a week is almost certainly going to be better off, have considerably more money accepting unemployment than not receiving it, even though their SSI, their SNAP, the food stamps, and certain other benefits might be reduced or stopped. Okay, next question, Dallas. I think we'll do one more.
Okay. Raylene wants to know, with means-tested benefits, how will this impact the $2,000 resource limit?
Yeah, it's a good question. The resource limit for many benefits, particularly certain types of Medicaid, is generally very low, about $2,000 a month in most states. I'm sorry, not $2,000 a month, $2,000. The limit on assets, also known as resources, is a flat $2,000. That would be things like bank accounts. So can a person who's getting these big unemployment benefits save money without losing eligibility for things they need like Medicaid? Well, we've talked about the fact that even if they are no longer financially eligible for Medicaid, they'll still be able to keep it at least through the end of the COVID-19 emergency. But what if they want to keep it longer? Well, what a person may be able to do is save some of that money, maybe well over $2,000 of it, but save it in ways that don't affect the resource or asset limits. In other words, there are some types of assets that are not counted against those limits, the $2,000 limit or another dollar amount, whatever that limit might be. One great example is ABLE accounts. Many of you probably heard of ABLE accounts. These are special accounts that are owned by a person with a disability who controls the money in them. And the money in the accounts does not count against the asset limit for public benefits that have asset limits. To be eligible for an ABLE account, a person has to have a significant disability that started before age 26. So it's not going to be for everyone, particularly people with disabilities that occurred at age 26 or later, but it can work for a lot of people. There may be other options. Usually a motor vehicle or a home don't count as assets. So if somebody wanted to buy a car, put a big down payment on a car or a house, with the money they're getting through unemployment, they could do that without that money counting as a resource, counting against the asset limits. So there are some ways that people can save money without going over the resource limits. Another good question for a benefits counselor. All right, and I'm going to move on now and hope to have some time for questions at the end. So if you'd like to get more information about unemployment benefits, you should definitely check your state's unemployment website. And I showed you on an earlier slide a link to find the link for your own state's unemployment website. And if you're a glutton for punishment, you could read sections of the CARES Act that deal with unemployment benefits. And there's a link here on slide 46. Now we're going to move on to economic impact payments. This is a different form of financial assistance that the CARES Act provides. Now, unemployment assistance that we talked about would only be for people who had previously been employed, who became unemployed or in some cases partially unemployed as a result of COVID-19. But the economic impact payments are payments that the vast majority of adult Americans will be receiving, many have already received them, that don't have anything to do with employment. People can receive these payments if they've never worked a day in their lives. These payments are also known as stimulus payments, and they're designed as part of the strategy to help keep the economy from collapsing by pumping more money into the economy through individual consumers getting more money that they can then spend within the economy. So to be eligible for the economic impact payments, a person has to be a U.S. citizen or a resident alien. They have to be living in the U.S. legally. Undocumented immigrants would not be eligible. But non-citizens who are living in the U.S. legally are eligible. Have to have a valid Social Security number. You could not be claimed as a dependent on another person's taxes. That means certainly nobody else is claiming you as a dependent, and nobody else could claim you as a dependent. To be claimed as a dependent generally means that another person is paying at least half of your living expenses. Okay, so if you're paying more than half of your own living expenses and would not then be claimed as a dependent on someone else's taxes, you would meet this condition. And you have to have adjusted gross income. That's basically taxable income below certain limits. The basic payment amount that the great majority of people will get is $1,200 for an individual or $2,400 for a married couple who are filing a joint tax return. Plus, if you have dependent children who are going to be under age 17 at the end of the year, in other words, they'll be 16 or younger on December 31st, then you can get an extra $500 for each qualifying child. So those are the amounts that the vast majority of people are going to get. Let's do an example. Let's say that a married couple that files a joint tax return has 2 qualifying children. Both are dependents. Both are going to be 16 or under at the end of 2020. How much could that family get? They'd be able to get the $2,400 for the married couple, $500 for each qualifying child. That's a total of $1,000 for the 2 qualifying children, for a grand total of $3,400. Now, if a person's adjusted gross income, their taxable income, is below the limits on slide 50, they'll get the full regular payment. So if they're single, if their taxable income is under $75,000 a year, they'll get the full $1,200. If they are a head of household, which means they're single, but they have dependents, if their income, their taxable income is under $112,500 for the year, they'll get their full $1,200 payment, plus the full $500 additional payment for each qualifying child. And if they're married and they're filing a joint tax return, their taxable income is under $150,000 a year, they'll get the full $2,400. But what happens if their income is more than this? Well, then the amount of the payment they'll get will be reduced, and it'll be reduced by 5% of the amount that their income exceeds the limit. So let's say that a single person has income of $85,000 a year, taxable income of $85,000 a year. That's $10,000 above the limit. 5% of that $10,000 would be $500. So their payment would be reduced from $1,200 down to $700. But I would imagine that the vast majority of people you may be advising are going to have incomes below these limits, and they'll get the full payment amount. So this has been a big hot issue in the news lately. Is there anything you need to do to get your economic impact payments? Well, it depends. Most people will get the payments without having to do anything. Anybody who filed a federal tax return in 2018 or 2019, or both, will get a payment without having to do anything. People who get SSI, Social Security Disability, Social Security Retirement, Social Security Survivor benefits, or railroad retirement benefits, and who started receiving them in 2019 or earlier, which means that they got a 1099 form at the end of the year that's said this is what your benefits were, and the IRS got a copy of that form. They don't have to file, and if they don't file tax returns, they will still get the economic impact payments without having to do anything. But there are other people who need to enter information into a portal that the IRS provided called non-filers. Enter payment info here. And there's a link on slide 52 to that portal. So who needs to put information in the non-filers portal? People who get benefits from Social Security, SSI, or railroad retirement, who don't file taxes and have qualifying children. Now, those people will be able to get their regular benefit amount, the $1,200 or the $2,400 for married couples. But the reason that they should be entering the information is that the IRS won't have information about their qualifying children, and they wouldn't automatically get the extra $500 per child. Now, unfortunately, yesterday was the deadline for people getting Social Security or railroad retirement to use the non-filers link to enter information about their qualifying children to get the extra $500 per child sooner rather than later. People who get SSI and have qualifying children can still use the non-filers link for their qualifying children through the end of April. Now, what happens if you miss the deadline to enter the non-filers information and you get your payment without the extra $500 per child? Well, you'll still be able to get the extra $500 per child, but not until you file a tax return at the end of the year or the beginning of next year. So you'll still get the money, but it'll be significantly delayed by a good number of months. Other people who need to use the non-filers link, people who started getting Social Security, SSI, railroad retirement in 2020 and didn't file taxes because the IRS won't have information about them getting those benefits yet. Also, people who didn't file taxes in 2018 or 2019 and are not required to file in 2019 and don't plan to file taxes for 2019. Okay, so how will people receive their payments? Either by direct deposit or by check in the mail. If a person gets Social Security, SSI, or railroad retirement benefits and they receive them by direct deposit and don't file tax returns, they should get their payment through direct deposit into their bank account. If they had tax refunds that were directly deposited into their bank account for 2019 or 2018, if they haven't filed their 2019 taxes yet, those payments will also be direct deposited into their bank accounts. If a person doesn't qualify for direct deposit automatically in one of those ways, they can use a different link the IRS provides called a Get My Payment tool that would enable them to request direct deposit of their payments. If they don't do that, or if they're too late, they'll get the payment by check in the mail, snail mail. So here's some good news. How do the economic impact payments affect other benefits? Well, they're treated as tax refunds, and tax refunds don't count as income for any benefit that's federally funded or partially that is that's based on financial need. So economic impact is income for SSI, Medicare, So HUD-funded rental assistance program or VA disability pension. So economic impact payments won't.
Hey, Michael, can you hear me?
Yes, I hear you, Dallas.
You're breaking up a little bit. I'm not sure if it's like an issue with your internet or what, but a couple people have typed in chat that it's a little hard to hear you. You're a little garbled. I'm not really sure how to fix it.
I apologize. Please, Dallas, please let me know if this is getting better.
It sounds fine to me now, but it's kind of like an intermittent thing.
Okay. All right. Please stop me if it happens again. I'll see if there's anything I can do.
All right.
We're in the last 10 minutes here, so I'm hoping I can make it through without too much ado. So we talked about benefits that have limits on resources or assets. Well, the economic impact payments don't count as resources or assets for a year, 12 months after they've been received. So they won't count against those asset limits. And it's probably a safe bet that people are going to be spending the economic impact payments within a year after they get them, which means there would be none left over as a resource or an asset at the end of the year. Economic impact payments, more good news, are not taxable. Now, can economic impact payments be withheld to repay outstanding debts? Well, the good news is not by the government, with one exception. So the government can't withhold these payments to pay overdue taxes or other federal or state debts, with the exception of past due child support. That's the only obligation, the only debt managed by the government that can be taken out of the economic impact payments, just child support. Here's the bad news, though. Private creditors, in some cases, even people's own banks, even nursing homes that people live in, long-term care facilities that people owe money to, can try to claim those payments to settle those outstanding debts. So there's nothing patently illegal about it. Many people, though, would consider it to be unethical.
That's your little girl, your 3-year-old little girl. You had sex with you and my ex. That's it.
So if a person faces this, if a person has creditors who are trying or may try to take their economic impact payments, they should contact their state consumer affairs office or elder affairs office or the local legal services agency for help trying to prevent that from happening. And last slide here shows a link to the IRS's economic impact payments page, and also a link to an article that the National Consumer Law Center published that provides strategies to help protect the economic impact payments from being seized by private creditors. Okay, and now the rest of our time we can devote to questions. So has the audio been okay since you pointed out the problem, Dallas?
I think so. You sound pretty much fine to me now.
Okay, great. All right, so so I'm sure we got some more questions.
Yeah. Okay. Cindy wants to know, can someone in a work activity program earning sub-minimum wage file for unemployment?
If the person is on a payroll, if they are an employee, they're in a work activity program, It's likely that they wouldn't qualify for regular unemployment insurance because they probably wouldn't have earned enough during the base period. But they could potentially be eligible for the pandemic unemployment assistance, the benefit for people who don't qualify for regular unemployment benefits. I don't know this for certain, but I think that since even people in the gig economy can qualify and there's really no minimum earnings amount they had to have received, that it may be possible for people in work activity centers or sheltered workshops possibly to apply, to qualify. I don't want to say that for certain because the answer may differ from state to state. And again, this is an issue that hasn't been resolved. I'm sorry that I keep using that refrain in the answer to a number of your questions, but this stuff is just so new and evolving. You know, these laws were passed so quickly, and states are doing everything they can to implement the rules. There are just a lot of detailed questions that nobody's had the chance to answer yet at the federal or state policy level. It's a good question. I would say it's worth a try. And next question.
Okay, Gail asks, if someone is an SSI recipient but claimed on their parents' taxes, will they get a payment?
Unfortunately, they will not. A person who is going to be 17 or older at the end of the year would not be a qualifying child, so they wouldn't be able to get the family wouldn't be able to get the extra $500 payment for them. So if they're 17 or older at the end of the year and they're claimed as a dependent on their parents' taxes, they will not be eligible for an economic impact payment, unfortunately, because the criteria that we looked at for who is eligible included that you could not be claimed as a dependent on another person's taxes. So that's going to be the big exception for particularly adults, is those who have little money and who are claimed as dependents on their parents or other family members' taxes. They won't be eligible for economic impact payments. Okay, next question.
Okay, Levon wants to know, would the regular SSI monthly payment be reduced because of the stimulus pay?
No. The stimulus payments, the economic impact payments, are not counted as income for SSI. I'm back to slide 56 here. SSI, Medicaid, SNAP, HUD, temporary assistance to needy families, or VA pension benefits, or other partially or fully federally funded means-tested public benefits. So no, a person who gets SSI and gets an economic impact payment will not have their SSI reduced by the economic impact payment. And the payment they get won't count as a resource. It won't count against the $2,000 resource limit for SSI for 12 months. So if they spend it within 12 months, none of it will be a resource, will have no impact at all on SSI. And we might have time for one more question.
Okay, Rika wants to know, would someone who did a two-year paid internship that ended a few weeks before the pandemic qualify for unemployment?
So they were in a paid internship. The paid internship ended before the coronavirus emergency was declared. Would they qualify for unemployment insurance? Probably not. First off, if it was an internship and it ended, it wasn't a matter of them being unemployed. It was just an internship that ran its course and ended. And it ended before the coronavirus emergency was declared, I would think it would probably not. They would probably not qualify for unemployment benefits. That does not mean they should not apply. It doesn't hurt to file a claim and try. And how many more questions are there, Dallas?
There are two. One is, I know you said you wanted to avoid sort of really specific questions. One's super specific and one is less so.
Okay, why don't we go with the more general question? Since there are only two left, I'm going to go ahead and answer them now. If people need to sign off, it is the top of the hour now, and I certainly understand, but I don't see any point in sending written answers to one or two questions. I'll just answer them now.
Okay, the first one is from Brianna. She says, are individuals who receive SS retirement or any SS benefits going to be the last to receive their stimulus checks? I know a few families who receive SS benefits and have not received their payment.
You know, you may have noticed that the one question that people usually have about economic impact payments that is not addressed in the PowerPoint is, when will you get them? And I did that for a very good reason. Because if people ask you, when am I going to get my payments, or when am I supposed to get them, and they don't get them when they're supposed to, you know who they're going to come after. They're going to go after you. So I don't trust this system, particularly since this is all brand new and the rules are literally being invented as they go along. I don't trust that these payments are always going to arrive when they're supposed to. So I don't even address that. If people ask me, when am I going to get my payment? I will tell them, I'm sorry, I don't know. Now, you know, the IRS is saying sooner rather than later, that they're talking about maybe having all of them sent out by sometime in May. I'm not telling that publicly to anybody who asks me, because it only sets you up for trouble if there are glitches or delays. You know, just tell people that they're eligible and what they need to do to get them, if anything. But I definitely advise against telling people when to expect the payments. And then the last question.
Okay, this is the really specific one. This guy emailed me a while ago. I'm sorry, we're just now getting to it. He says, I work in a school as a substitute special education trainee and applied for unemployment benefits with the presumption that I would not get paid while the schools were closed. It was not until a week after I certified for the benefits the first time that I learned that the school district is paying me a disaster check equivalent of my regular paycheck for the rest of the school year. A summer job I was offered was canceled due to the coronavirus. How should I proceed to certify for unemployment benefits?
Okay, if you're still getting payments that equal the full amount of your regular pay through the end of the school year, then you will not be eligible for any of the unemployment benefits we've talked about, regular or otherwise, through the end of the school year. That's the short answer. Now, if you remain unemployed beyond the end of the school year, and you continue to be unemployed or possibly partially unemployed during a period when you would ordinarily be receiving, particularly if the coronavirus emergency is still in effect and it's before the end of the calendar year, then you may be eligible for some of these benefits we talked about. So I would advise not bothering to try to apply for unemployment, to file a claim again, until the payments that you're receiving have stopped. Okay. And any other questions, Dallas? Is that it?
No, I think that's it.
Okay, wonderful. Well, thank you very much, everyone, for participating. Hope this was helpful, and please stay safe and healthy.